Were doctors of the Renaissance any better than before? The Renaissance period saw an explosion in interest in science. The church had less influence over people's daily lives, and people seemed more willing to challenge old ideas. Doctors were influenced by the works of Harvey and the Royal Society, and there was more sharing of new knowledge with advances in printing. There was change and continuity with doctors in the Renaissance. Doctors still believed it was important to keep the four humours, or body's liquids, balanced. Bleeding and purging, or getting rid of impurities from the body, was still widely practiced. Doctors still used herbal remedies, but prevention was still thought to be the best way to avoid disease. Doctors therefore recommended having a balanced diet and avoid overeating or too much alcohol. Basic surgery said to cut off unhealthy boils or lumps from the body, but such operations were still pretty basic. Overall, these approaches to medicine were similar to the Middle Ages, so there was some continuity between then and the Renaissance period. There were also clear changes with doctors of the Renaissance to earlier periods. Doctors now had to hold a license to carry out their work. They were more likely to have better knowledge of science, such as early chemistry and understanding of ingredients to use in medicine. Some teachers of training doctors were more willing to experiment and to challenge old ideas. Human dissection was no longer illegal. Printing presses made books and articles cheaper to produce, so there was improved sharing of knowledge and improved medical education overall. There was increased travel and exploration in the 1600s, so Renaissance doctors began to use many new plants and herbs in medicine from as far away as South America. Ipecac, a plant syrup from Brazil, for example, was used to treat an upset stomach and bad diarrhea. Tea, coffee, and even tobacco were also tested for healing properties. Understanding of chemistry advanced too, and mercury was used to dull pain. Unfortunately for patients, however, an enema that went into the bottom was often used to get mercury into the body. Another new idea was transference. This was the idea that illness could be moved or transferred from the body to something else. So a patient, for example, might rub an onion on a nasty wart in the hope that the nastiness of the wart would be transferred to the onion. There was certainly a wider range of treatments available to doctors in this time, but proper understanding of the root cause of disease was still some way off yet. Doctors did not yet know that germs cause disease, and if you did fall seriously ill, the Renaissance doctor would not have been able to do much more to help you than the doctors of the Middle Ages. Key learning. There was continuity between doctors of the Renaissance and the Middle Ages. Renaissance doctors still used herbal remedies and bloodletting to balance the body's humours, or liquids. There was change too. Doctors needed a license to practice. They still trained at university and charged fees, but they took a more scientific approach to medicine. There was more emphasis on practical work, experimentation, and challenging Hippocrates and Galen. There were new treatments available, but most still weren't very effective. Renaissance doctors still did not understand about germs as the real cause of disease.